Bismillahirrahmanirrahim. My name is Dr. Irfan Malik. I am working as Associate Professor in Pulmonology Department, Lahore General Hospital. Other than that, I am working as a Director in Sleep Research Lab, one of its own kind in public sector. I am working there as a Director. Today I am going to talk about what is sleep and is there any disorder associated with the sleep? If yes, then how we diagnose and then how we manage this sleep disorder. Unfortunately, sleep specialty in Pakistan is still underestimated, underdiagnosed, and the disease related with sleep still has yet to be diagnosed. Sleep is what I feel. I feel sleep as a important vital sign. Like we say, pulse is an important vital sign, so it has a rhythm, and we calculate it with a rhythm of 60, below 60 and above 110, and then blood pressure and then temperature. So everything which we measure in sense of pulse, temperature and blood pressure, we call it as a vital sign. So is sleep is also a vital sign? So my answer will be yes, because it's a rhythmic process which goes on regularly in our body. So why our body requires sleep? This is very important question. When I go through this sleep medicine, 1/3 of our time we spend while sleeping. This means a 60-year-old male or female spend 20 years while sleeping. So you can well imagine why this sleep is important. 20 years we spend while sleeping. During sleep, our main organ, one brain, second muscles, they relax. So we need this relaxation to ready ourselves for the next day of activity, plus to memorize our all functions which we have done throughout the day. So what are the symptoms which can disturb sleep? So most important symptoms which we come across are snoring. Unfortunately, in our setup, people think snoring is a healthy sign. We snore because we are healthy, but this is vice versa. It's not like this. If you snore, and specifically if you snore with a pause, which is called as apnea, this means you are suffering from a disease which is called sleep apnea, and it's, believe me, it's a very common disorder. As we don't have statistics available, but I am doing clinic, so I come across such patient, a lot such patient with different presentation. So patient usually says, Doctor Sahab, I sleep very well. I sleep so much that I even goes to sleep while I talk, while I watch TV, while I read book. So patient think this is a healthy sign. I rather oversleep. But the partner tells us when patient sleeps, so I feel as if patient respiration is suddenly shut down, and I wake the patient. So this is the history which is given by the partners rather than the patient himself. So this is very important for us. When we ask the patient says, Doctor, I don't have any issue while sleeping. So whenever we suspect any patient having sleeping disorder, so we have to ask from the partner. And the most important symptom I already told you people is apnea, sleep apnea, especially with snoring. So what is normal snoring? 44% of public normally are habitual snorer. So normally snoring is in a rhythmic process, like if there is a pause like this, followed by a loud snoring, and there is body movement, patient waken up, patient moves any of the body limbs, this means this is disturbing your sleep. So why this happen? When you go in deep sleep, your body relaxes and your tongue falls backwards, so you have apnea, and that comes when you goes into deep sleep. So this means whole night you can't go into deep sleep. What happen if you don't go into deep sleep? So when you don't go into deep sleep, this means you are not fresh. You wake up with fatigue, lethargy. And because of this inability to sleep, you usually go to the washroom on regular basis, and you feel like I'm suffering from diabetes. And most of these patients who is having sleep apnea, they are usually obese, and obesity means there is a vicious cycle, because the patient usually sleep throughout the day, patient don't do any physical activity, so patient weight again increases, and this vicious cycle continuously started. Obesity means diabetes, hypertension, increase in uric acid, depression, loss of libido, and there are a lot of multiple disorders which is associated with this obesity along with sleep apnea. So I call this sleep apnea the mother of metabolic syndrome. Problem is this disease is not that common. So most of the physician, GPs or even consultants are unaware of this disease. So they manage the symptoms only, and the patient come to us very late. And second problem is the diagnostic facility in Pakistan is very limited. I'm lucky to have this sleep lab, and I'm working in this sleep lab for the last 10 years almost. but the cost of this sleep lab is too much. So every patient is not that rich to reach in our sleep lab. So this is the first issue with this sleep problem. Patient is unable to reach in the sleep lab because this is costly. Second, after the diagnosis, the device which we give to them is also very costly. So that is the reason I personally believe patients usually don't try to go into these kind of sleep center. And I hope in future we have multiple companies which will jump in and will help us in reducing the cost of this device. So what happens when you diagnose a patient with sleep apnea? I usually call the patient in my sleep lab, and the patient stay in the sleep lab for whole night, and then usually we diagnose in first 2 hours and manage the patient in next 4 hours. The management of sleep apnea or sleep related breathing disorder is primarily weight reduction, but believe me, weight reduction will not be there if patient will not have this optimal sleep. So I always says give them a better sleep, then they will start their work. So we advise them device, and then we give them a target to reduce their weight within 6 months. If it is so they reduce their weight, then it's okay. If they are unable to reduce, we refer them to any surgeon who go for bariatric surgery in the patient. The role of surgery is limited. Because of these devices, we never come across such patient which we referred. Yes, if a patient have some mandibular problem, some local jaw problem, that may be referred to a maxillomandibular surgery. The medicine, yes, there is a medicine which is called as modafinil, may be used in patient who is not responding to our these devices. So cut this all disease short. This is a sleep disorder are very common. This is as common as our asthma problem. Unfortunately, they are underdiagnosis. Unfortunately, we don't have these labs available, and they are very costly. Every snoring is not a sign of healthy. If you snore and you tired throughout the day, this means you are suffering from some disease which is called as sleep related breathing disorder. 19 March is World Sleep Day. This time slogan is regular sleep and healthy future. Sleep is a very important vital sign, and please don't underestimate your sleep. If you sleep well, your body refresh very well, your body memorize your whole day activity, and also solve the problem which you come across throughout the day. So my request from you all will be, which is a very important phrase, early to bed and early to rise makes a person healthy, wealthy and wise. I wish everyone to have a sound sleep. For further detail, if you have any query, you can call at the number which is there on your screen, and I hope we will be able to answer your every question. And thank you very much for patient listening.